Thank you, Damien. Merci. It's an honor and great pleasure to work here and be here with you. I have a financial disclosure with Oculus, of course, I have worked for about 20 years now, and some other companies that are related to this, and also the Ambrosio Vision Academy. The eyes cannot find if your mind does not seek, nor you can see without the power to perceive. And knowledge will come and unveil through deliberate scientific inquiry and consciously work. So topography evolved to tomography. Tomography we can do with Scheimpflug and also with OCT and very high frequency ultrasound. It's important that we see the evolving imaging that we have with biomechanical properties as well. For example, the biomechanical assessment that we have with the OCT, with the Corvis, we take in 31 milliseconds, 140 frames, and we can see detail in this nice FWCRS screening report that was designed to combine the data and give us the CBI, the corneal biomechanical index. And we can evaluate if the cornea is softer or stiffer. Interestingly, we can call things by the proper name to start with wisdom. So, interestingly, we have multimodal refractive diagnostics, and even the role of AI in this situation here to combine the data to give us practical and objective answers. So AI is combined with ancient intelligence. Those is the why and the hows. We apply ancient intuition to go beyond as well. So when we think about keratoconus diagnosis, screening is different than characterizing ectasia susceptibility prior to laser vision correction. When you confirm the diagnosis, you have to understand the staging of the disease, classification of the disease, give prognostic factors for individualized management and clinical follow-up. This case, for example, has a normal topography in the right eye with 20/15 distance correct vision. You see a different scale. This is the keratograph 5. And the topography in the right eye is normal with 2 different scales. So how advanced image can help me? First, with a low stiffness, high CBI, high TBI, this is a form-fruit keratoconus or a susceptible cornea. The fellow eye of this patient has not advanced keratoconus, but a high risk for ectasia progression based on SPA1, very low. And besides of age, low biomechanical properties indicate a risk for progression. If you see Kmax decrease from 6.1 to 59.6, but there's a steepening here. And if you see the subtraction maps, this agrees with the Bellin A, B, and C with a statistically increase in this patient is progressing. So you have to cross-link this patient. It's been 10 years of the Pentacam into 2012, and now past 20 years, and this is a beautiful gold Pentacam that we had at the Academy that year. But the Pentacam family is growing. We started with the first generation Scheimpflug camera, the HR plus PCI for axial length, now with a Hartmann check with the Pentacam XL wave, and I was using this slide a lot, to be continued. And I would say still to be continued as well, but today, we have the Pentacam Cornea OCT, and I was honored to collaborate with Shai Miller for a long time, and this very nice introduction of the Pentacam Cornea OCT that we see today. A lot of people say that we don't need Scheimpflug. I would say this is not correct. There is synergism, and synergism is when 1 plus 1 is more than 2. Sometimes you have subtraction. 1 minus plus 1 is less than 0. But here there's a true huge synergism. And the high resolution of 1.9 microns is very impressive. So the ultra-high resolution is related to a couple of things. There's a broad bandwidth for the spectral domain OCT, and that's a good factor for having high resolution. But it's a limiting factor because we only have the cornea OCT. So the name cornea OCT is very, very appropriate. We also have a scan geometry because the Scheimpflug image takes at the same time simultaneously with the OCT is this wide pericentric scan system in which you have 1.9 microns resolution over the entire 17 millimeters of scan diameter. So it's a very impressive and a lot of data. The synergism is also going to be important because you have a huge scanning of the cornea. So you need to have this data that we have analysis of the cornea surface. It's important that we understand is that one single rotation that we have the Scheimpflug and OCT taking these images. And this leads to high amount of data in the center for power calculation, for example. So the first thing is that trustable epithelial thickness mapping accuracy and precision is a study done at the Oculus in-house study, 37 healthy participants. There were 3 Pentacam OCTs and 3 Solix systems. So there was not only looking at the repeatability of the cornea OCT data, but also to see the correlation with the Solix data. And the 3 repeated measurements in the 9 devices were done in all these cases. And the data was in the central, 2 millimeters, and with 16 areas that were divided like this. So these results make the point that the mean difference between the Solix, which is considered the gold standard today for OCT epithelial thickness, is less than 1 micron. So it's very small difference of OCTs on the Pentacam and the Solix. So it can be used eventually interchangeably. The interesting thing is that we have high repeatability and reproducibility. A small standard deviation of 3 microns makes it in the state-of-the-art precision for epithelial thickness mapping. So every time you see any measurement, challenge if this is trustable, and the first thing is the repeatability with the standard deviation evaluation, the coefficient of variation, which is dividing the standard deviation by the mean so that you can see the percentage and you can see how these measurements can be interchangeable. So this is an interesting patient with 55 years old. She has 20/20 minus 1 in 2015. And you see, this is the tangential and the axial curvature from placido, right and left eye, and you see relatively normal topography in the left eye. Interestingly, you have abnormal TBI in both eyes. So this is a very asymmetric ectasia with a form-fruit keratoconus. And we see the epithelial mapping that you have a pattern of thinning here. And it's interesting because if you see the OCT in the past, they had a blue in the thinner epithelium, which is kind of confusing. But we learned how to use these maps for over 10 years. But now we have a very nice scale that we can even optimize it further. You see a thinning pattern with a very high repeatability and precision. So when you think about form-fruit keratoconus or susceptible corneas, I think epithelial thickness will come to add data. It's not going to replace data. Why? Because the epithelium by definition, and I would say the Einstein law of epithelial thickness compensation, we published that about 10 years ago now. We have the epithelium to thicken to fill depressions, to thin over the peaks, and this is going to be proportional to the change. And those are 3 images of 3 different patients. You see a post laser vision correction, you have a thickening of the epithelium. You here have a scar in advanced keratoconus, and you see thinning and thickening, and you see some thickening here with the scars. And it's interesting that the understanding of Pentacam Scheimpflug and OCT are going to be very much synergic. We published this recently in July 2024, the understanding of optical biopsy. And I have a couple of examples. And this is what we mean as studying light. You see, Scheimpflug is already very impressive. I remember the first days when they installed the Pentacam, and Ivan came to my clinic with the Pentacam the first time in 2004. I was really, really amazed with these images. And it was the first generation Scheimpflug. But now you see how different you can get of information, of the opacity. And the lack of detail here is an advantage. As Christian Kirchhuber was telling me in the very early days on the Pentacam OCT use, the Scheimpflug is much better to see opacity because it backscatters light. The OCT is a signal that's processed. So we can see here the detail of the tissue, and here you can quantify the opacity of the tissue. That's to start with the application of synergism. So this is a patient with a pterygium that is a mild pterygium. The patient came as a refractive cataract patient. And you see there's a cataract here. You see the cataract here, but not here. And the Pentacam OCT, I was able to show the patient, you see you have something in the middle, so we have to address that first. If you do a toric IOL here, probably is not going to be the best outcome. So it's good to show to the patient. This is another patient and a half dozen. It was actually a hard job to select the patients to show in this meeting because I had kind of limited time. But this is a patient with I have done a PTK in this patient in the past for lattice corneal dystrophy. And you see the dystrophy and you see the epithelium, and I was able to look at the center of the cornea and with this data indicate and eventually plan. And we are just looking at the first iterations on how to use this data to improve PTK as a therapeutic procedure. This is a patient with a corneal ring and the corneal ring depth, and it's important to tell these patients not to rub the eyes, because if they keep rubbing the eye, the ring is going to go superficial. So it's important to have this data also to educate these patients. And for most of my keratoconus patients, I don't do a transplant as first procedure. This is a case that, unfortunately, I had to go for an indicating transplant, because if you see, the thickness of the stroma in the center is very low. So that's a very important data when you think about doing ultra-thin corneas. You can consider that, but this patient will likely have a benefit from DOLC, and you can see the Descemet's membrane is good, so it's likely to have a good DOLC procedure. So the Pentacam Cornea OCT is a Scheimpflug plus spectral domain OCT with 200 nanometers spectral domain bandwidth, giving the resolution of 1.9 microns. This angle pericentric scan is perpendicular to the cornea with the same resolution over the entire 17 millimeters. It's 50,000 scans per second, highly repeatable epithelial thickness maps. One benefit is that you retain all your data with your Pentacam. So your Pentacam data will be there and you can do comparison maps eventually in the future. Artificial intelligence applications are really an exciting moment for doing that. A lot to do with this. I'm very happy and grateful for being here, and I thank you very much for your attention.